And it's time now for health news. In Focus Health correspondent Lino Madu is off this week.
Here in the United States, the first H1N1 swine flu vaccinations are now available. The World Health Organization says that more than 4,000 people have died from the virus since it was first identified in March. Recently, health officials were concerned that bird flu would be the next viral pandemic. VOA's Carol Pearson looks at the differences between the H1N1 swine flu with the H5N1 bird flu.
The H1N1 swine flu is spreading rapidly in the northern hemisphere, while the number of cases in the southern hemisphere has eased. H and N are two types of proteins contained in serious influenza viruses. Dan Rutz of the U.S. Centers for Disease Control says the chances of dying from the circulating H1N1 flu are less than 2%.
This seems to be a fairly mild illness for most people.
Mild, but it can also be deadly. Pregnant women are especially at risk, and the U.S. Centers for Disease Control reports at least 100 have been hospitalized and at least 24 in the U.S. have died so far from the swine flu. The young are also at risk. 2 teenage girls, one in Maryland, the other in Texas, recently died from the virus. Normally healthy teenagers have died from the virus in recent weeks. The risk of dying from H1N1 is no greater than the risk of dying from seasonal flu. The problem is, most people lack immunity, so the virus spreads easily. Although the virus was called swine flu early on, it does not seem to be transmitted by pigs.
This is a disease of human beings, not of pigs at this point.
Rutz says health officials have been expecting a flu pandemic for some time, but they thought it would originate in Asia, not in Mexico.
Bird flu has been around for a long time. We thought it might change, that virus might change in ways that would make it more transmissible human to human, that it, in fact, could trigger the next pandemic, and it has been preempted by the H1N1 virus instead.
Most people who contracted bird flu, an H5N1 virus, came into contact with sick birds. There have been fewer than 500 cases since 2003, but the death rate is 60%. Most of the deaths have been in Asia. Health officials are concerned that the virus could mutate into a form that can spread easily among humans. But governments have been vigilant about killing sick birds, and so far, the bird flu virus has not mutated. Carol Pearson, VOA News.
Now, more than 120 million people worldwide are infected with elephantiasis, and 1 billion more are at risk of contracting the debilitating and disfiguring ailment. Infection is rampant in parts of Africa and Asia. Rachel Smalley reports about the stepped-up efforts to combat the parasitic disease. We have to warn you that this video contains graphic images that may be difficult for some of you to watch.
Lymphatic filariasis, more commonly known as elephantiasis, afflicts many of the world's most vulnerable communities. A parasite that infects the human lymphatic system is responsible for the condition, which causes swelling and deformity of the limbs and other body parts. Mosquitoes spread the tiny parasitic worm that causes elephantiasis from person to person. The disease is endemic in 83 tropical countries, and Professor David Molyneux of Britain's Liverpool School of Tropical Medicine says anyone living in those places is at risk.
The total numbers of people which have been estimated by the World Health Organization to be at risk in these 83 countries is about 1.3 billion people. So let's say a fifth of the planet is at risk.
There are few conditions in the world more socially alienating. The Global Alliance to Eliminate Lymphatic Filariasis has been at the forefront of those fighting the disease. As the group's video shows, elephantiasis mainly affects the rural poor, forcing infected people like this man from Uganda further into poverty.
Mimi fundi seremala. Inanisumbua kama mtasimama muda mrefu bila kukaa chini.
Washing infected limbs can help ease the suffering, but it does not cure or stop the spread of the condition. This man comes from a village in Tanzania where elephantiasis is endemic.
malgré peuple a bon mouvement pour lui.
Set up 9 years ago, the Global Alliance aims to eradicate elephantiasis as a public health threat by 2020. The group has teamed up with the UN World Health Organization and major drug companies such as GlaxoSmithKline and Merck. Andy Bright heads up GlaxoSmithKline's elephantiasis program.
When the program started, there was a global plan produced by the WHO for how you could achieve this goal within 20 years. And progress against that plan is very much on target. So there's a lot of very strong evidence that the program is succeeding and a lot of confidence that in the vast majority of the countries it will be successful before 2020.
The eradication program consists of 2 drugs, albendazole, donated by GlaxoSmithKline, and mectizan, donated by Merck. Those living in endemic areas take 2 pills a year for 5 years. The drugs significantly reduce the number of worm larvae in the blood, which means far fewer mosquitoes carry the infection to those they bite.
We made an agreement with the World Health Organization to donate one of our antiparasitic drugs, albendazole, to every country that needs it until the disease is eliminated. And that's an enormous commitment that'll take 20 years or more and will involve billions of our antiparasitic albendazole.
Despite these efforts, there is much more to do in the fight to eradicate lymphatic filariasis. Populous countries such as Nigeria and Indonesia and others face logistical problems in delivering and implementing the program nationwide. Professor Molyneux says it should be viewed as the most important public health program of our generation.
If we can't afford to implement that intervention within existing health financing environments, I don't believe we could afford to do anything in public health.
Elephantiasis was once considered one of the world's most neglected afflictions, but those fighting it hope that by 2020 the disease will be gone. Rachel Smalley, VOA News, London.
For more news from Africa and around the world, go to voanews.com.